Ivermectin! Rogan. Sir, I broke my leg. Febendazole! Parasites everywhere! They're all around it! Get these parasites off the plane!
I have had it with these monkey-fighting snakes on this Monday to Friday plane!
For those of you who don't know, the reason this meme was made was because Mel Gibson went on the Rogan podcast and started saying nonsense about ivermectin and some bendazole, which is a class of antiparasitic medications or anti-helminth medications that are supposedly curing cancer left and right. Surprise! No. Plan Brie. Oh my God, 10 out of 10 meme. Emergency contraceptive cheese product? Wow. Wow. Talk about a 2-in-1. Plan B is available over the counter, so that is not misinformation, but it doesn't usually come with a side of delicious spreadable cheese on a cracker. I'm gonna throw in a learning point, even with a little Plan B. Your weight, or one's weight, can impact the efficacy of emergency contraception. Make sure you take that into consideration. Lactose intolerance is stupid, just tolerate it. You know what makes me smile with this even more? The fact that they're using word art. This was my childhood. I made so many glorious posters. Boy, it makes me happy because that little blue squiggly writing, that was my favorite one. And look, now I have scrubs to match it. And no, you're lactose intolerant because you lack lactase. That's why you eat Lactaid in order to get rid of the lactose intolerance. Heading to the optometrist made myself a little cheat sheet. What is the use of that? What do you get? And also, that's pretty hard to see. Like, if you could see that, you won. The win is inside of you, champ. Lol, who else eats their PB&J sandwiches raw? That's an unprocessed peanut butter and jelly sandwich, although that looks like processed white bread. So, almost got me there. Do you guys prefer your ibuprofen hot dog or hamburger style? Oh, that's a good question. I prefer my ibuprofen hot dog style. I find it easier to swallow. And I find gel caps even easier to swallow because they're slippery. There might be a little evidence that the gel caps work a tiny bit faster because they're easier absorbed, although the evidence for it is whatever, and if they're that much more expensive, not worth it. Cargo space? Car no do that, cargo road.
3, 2, 1.
Hey man, could you pass me my drink? Yeah, dog, I got you. Oh, it's like a petri dish. Just the digits are some of the dirtiest parts of the human body. And then you stick it in a sugary beverage. Yeah. Stuffed crust pizza. 9 out of 10 dentists. Oh my God, you're not supposed to eat the toothpaste. Is that Trump on the bottom? Yeah. Oh, that makes it even worse. And I'm not politicizing it. It was just a ridiculous statement. You need to start doing meal prep. Me. Get those hot dogs lined up? No, in all seriousness, hot dogs are considered a processed meat, and overconsumption of processed meats have been linked to increases risks of certain cancers. So you want to use these foods, not at all if you can, or as an occasional treat, but not as a mainstay of your diet. If smoking is so bad, why does it cure salmon? Oh man. I wonder what Dr. Gundry would think of this meme. He said, people who are in the longest lived time zones also smoke, and he doesn't think it's in spite of smoking, he thinks it's because they smoke. So I wonder if he thinks salmon are healthier when they smoke as well. You heard of Elf on the Shelf, but have you heard of Nutella on the patella? A little joint lubrication with some saturated fat hazelnut flavor? No. Nutella is not good for the joints. There's a lot of people who get these viscous knee injections or visco supplementation for osteoarthritis. It's supposed to like help lubricate the knee. But even with people getting multiple injections over time, I haven't seen a lot of great results for it, but I also haven't seen a lot of great evidence for it. Vaccinated single women in my area. The 5G thing really got me. Oh, they put 5G into your arm. Bro missed OG Fortnite twice. Bro was born 2 hours ago. Lunchly older than bro. Class of 2042. Yesterday is older than bro. Bro missed everything. Are they needling a child? I'm glad the child is swaddled in that blanket because otherwise all those disses would hurt. Fun dip. Pregnant. Is the package pregnant or are you pregnant? By the way, what is Fun Dip? I wonder if the Red 3 ban will be impacted by this. Seeing if there's any other girl in his heart. How do we know that's a heart surgery? What are we basing that off of?
I want to see the receipts.
Daily brain workout. 2 sets of counting to 10, 2 sets of alphabet, 4 minutes of trying to spell restaurant, then list animals until failure. Honestly, it's not a bad brain exercise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Newborn chillaxing after his perfect 10 out of 10 APGAR performance. I don't know, that baby looks quite small. But APGAR scores are important. They tell us about how the baby's doing based on things that we can see directly in front of us. Heinz, Bleen, bleach, and codeine. Oh, that's not a good combination. Like I know people say lean, oh, it's like cough syrup. It helps you prevent a cough or suppress a cough. People use it recreationally and illegally to make themselves high. I would go ahead and recommend skipping this, and Heinz should sue directly the individual who made that meme. Would you clap your hands holding these for 7.5 billion? Instantly. Mr. Clean Baby Eraser, contraceptive sponges. Oh my God. Not in the cleaning aisle. Nah, don't go there. You gotta be faster. Evaporated milk. It just evaporated so quickly. Chalupian tube, Baja Blast pouch, chalupas. Instead of the fallopian tube and ovaries, you have chalupas and chalupian tube. Sig Newtons. I do remember when I was growing up in Brooklyn, we had those candies that looked like cigarettes and it was always a joke. And then I realized what those companies were doing, were trying to trick kids into subliminally thinking that they are smoking so that when they grow up, they do smoke. And that's a big problem, so.
Not cool, man. Not cool.
My pee smelling normal. Instant NH. Oops, all Adderall. Oh my God, that's overdose quantity. So I'm not for it, but Captain Crunch always looked like something's going on with him. Like he was taking too many medications. 100% glizzy smoothie, non-GMO. Oh, ugh. Why is texture so important? It has to be some survival mechanism that reminds us of some food that is dangerous to us. Smoothie isn't meant to have an umami taste to it. That's just my take. Eminem, his palms are sweaty, knees weak, arms are heavy, WebMD cancer. No matter what symptom, cancer is always on the differential. I really can't think of one symptom where cancer is not on the differential, which was what makes those type of WebMD recommendations not super useful. Great for stimulating conversations with me as a primary care doctor and having patients ask good questions. Osteopathy, OMT technique for the treatment of impotence. Do you know what MDs did back in the day when someone had an infection? They bled them out as a way to cure their humors. We all make mistakes. And guess what? Maybe if someone's pudendal nerve is trapped, maybe that was a good treatment. Or maybe just a good placebo effect. All possible. Ozempic bear. Thin as in. Oh, because there was Cocaine Bear.
It's like cocaine Christmas.
Do bears have GLP-1? Researchers identify proteins that let sleeping bears lie. Pharmaceutical companies turn to grizzly bears for obesity research. I don't even want to know about this. This makes me uncomfortable.
Let's get away from the bear memes entirely.
Yeah, exactly. Rogaine Bear with the beautiful hair. Do bears get male pattern balding? Well, look at this. Smithsonian Magazine. Do other animals besides humans go bald? Certain primates literally pull each other's hair out until it causes baldness. Andean bears can get alopecia. That's not necessarily what Rogaine helps with, but found Dr. Mike. Who made this object? It's a mermaid, shirtless doctor with a little brown puppy? Someone send me this. I will put it on the shelf behind me. No, I won't, because that's a little creepy. Someone comes into my house, into my studio, and they're gonna be like, dude, why do you have a mermaid look-alike of yourself nude with a dog in its hand? It doesn't even look like your dog. Something special for tonight. Trojan pre-owned, just like new, re-lubricated. Jesus, this is disgusting. Reduce, reuse, recycle. Honestly, you should say reduce, reuse, recycle, and then reproduce because they're not effective anymore. Full leg cast above the knee. I don't know what injury she had.
Say, that's not a bad idea. Ow!
Angelica,
What happened?
Munchausen syndrome in full effect when a patient pretends to be ill in order to gain attention and or sympathy. There's actually a Munchausen by proxy where someone can actively make like their child ill to get attention and sympathy for the both of them. It's a really devastating illness because it presents so many complications. Like the doctor has to even suspect that it's potentially happening.
What are you gonna do?
I'm gonna take pictures of your insides. Say cheese!
We don't get full body x-rays for a leg pain. Like, there's no point of that. It's just exposing you to more radiation. They're targeted.
It's kinda strange at first, but after a while, you get to like it.
When the x-ray tech or the radiology specialist is in there with you, they actually start the machine up, go behind a wall so they're protected because otherwise they're exposed to so much radiation over the dozens and dozens of tests they do in a given day. It's not healthy.
We'll be sick forever unless I can extract some mitochondria from the virus and make a vaccine.
Okay, medically, he just spoke gibberish. Getting the mitochondria, the energy center of the cell, not the powerhouse of the cell, will not allow you to create a vaccine. If you want to create a vaccine, you create a protein on the surface of it, then you put it into the body and allow the immune system to recognize it. You know, the way that we traditionally make vaccines. I don't know what he's talking about.
Look, there's Carl's brain.
Where? I don't see it. Is it behind that walnut on a stick?
Your brain is a lot bigger than that.
I got people inside me.
Why, whenever they do medical procedures on cartoons, they like strap people in like it's a torture device? Right, they just traveled into the stomach. So right away, if this was to happen, the acid would melt their little inflatable raft here, and they would fall into the acid and lose their lives. Which is why, by the way, drinking alkanized water is complete horse poop. The reason I say it is because when you drink the alkanized water, that means it has like a pH of 8 instead of 7. It falls into your stomach acid, which has a pH of like 2. What do you think happens to the pH of 8 when it mixes with a huge container of pH of 2? No longer alkaline.
Well, where to next, Douglas? The mountains? The Arctic?
I feel like these are the current devices we have now. You hop on a Peloton, and it's like, where do you want to ride? Through what trail? And to me, like, I understand a lot of people don't have time to go outside or the weather's not cooperative, but like, folks, spend some time outdoors. It's cool too.
No. You need to start out slow, Doug. See, the important thing is not to strain yourself.
Amazing advice. No joke. In a cartoon. Right now, I had to just get back into working out. I used to bench like 255, 285 during my workouts. The other day I was doing 95, and it's okay. It bruises the ego, but it strengthens the muscles.
Nothing like a peanut butter and jellyfish jelly sandwich
Ew, peanut butter. Oh, that sounds gross.
to help you get to sleep.
And ideally, you don't want to eat too close to bedtime because then your stomach produces all those gastric juices, highly acidic, and then when you lie down and you're parallel to the floor and the gastric juices starts coming up, you get heartburn. Ugh. Smelly fridge syndrome?
The fridge!
No lie, that's how I sleep. I love it freezing. I like to sleep with multiple covers, with a hoodie on sometimes. I actually just got like one of these cooling mattresses. Maybe it's because I grew up in Siberia, and when I was in my mom's womb, I was like freezing all the time, so I want to go back to that. That's why I always sleep in the fetal position.
Don't be silly, Gary. I don't get colds. I get the suds. No, Gary. If I had the suds, I'd have bubbles coming out of me.
Oh no, he has the suds. Grandma was right to a degree. If you go outside and your hair is wet or you get a chill, it doesn't mean that you're gonna get sick. It can just make you a little bit more susceptible than you were before.
Hey, SpongeBob.
I'm sick, Patrick.
I'm gonna go ahead and guess that he has adenovirus, because you know, he has the conjunctiva that's inflamed, he has the upper respiratory symptoms. I don't know if he has diarrhea. I mean, he probably doesn't have diarrhea because he's a cartoon sponge after all. But if a cartoon sponge was to have diarrhea and inflamed conjunctiva and upper respiratory symptoms, adenovirus.
I know a guy who knows a guy who went to the doctor once, and the doctor's office is a horrible, horrible place.
It is not. We have fun there.
Well, first, they make you sit in the waiting room.
Is that the horrible part, Patrick?
No, it gets worse. They make you read old magazines.
I don't know why that is. Can we update our magazine collection in the medical offices? For God's sake, who wants to read about People magazine from 2006? I mean, we know Britney was killing it back then, but we want to know what's up now. Was that the year she was killing?
Then the doctor pulls out his stethoscope. It's a device so sinister, so icy cold when it touches your bare flesh, it...
Honestly, the cold stethoscope is one of the meanest things a provider can do for you. Every time before I make contact with a patient's chest and or back to listen to lungs, I do one of these. And I get some of the warmth of my hand onto the stethoscope. It's the least you can do for your patients.
You gotta help me get better, Patrick. Please.
I'm so excited to see what Patrick's about to recommend. If he says Manuka honey, I might give the starfish a high five. I have been a doctor for like 7-8 years. Medical school, 4 years. I do not know what that thing is on Patrick's head that doctors used to wear back in the day. It doesn't make sense. It reflects light. It has a hole in the middle. I have no idea what it is, what it does. I've even worn it as part of a Halloween costume. Oh my God, I actually look like a doctor.
It appears as though we'll have to plug up these holes. This ought to do the trick. Voila! Feel better?
I don't know.
Well, I'm gonna do a hyper-analysis here. See, what's happening is instead of treating SpongeBob's core illness, he's treating the symptoms only. If this is a viral illness, that's a perfectly acceptable way to go about it, to allow the immune system time to heal, to rest, to improve itself. But if it's a bacterial infection, we're missing it. We're treating symptoms and not treating the underlying cause. Could be a big cause for concern there, Patrick. My lawyers will be in touch. Or as my legal eagle friend says it, I'll see you in court.
I'll see you in court.
Feeling better yet?
Not really.
Why did he pull out his tooth?
How about no?
I don't think so.
Actually, you may think this is silly. This is something we sort of do in the hospitals. It's called chest physical therapy. If a patient has a lot of mucus, we actually have specialized beds that perform this like thumping feature that helps clear out the mucus. In patients who have cystic fibrosis, we actually need this type of chest physical therapy to be done on a regular basis in order to help them expel that mucus and prevent blockages in the airways. Kind of crazy that SpongeBob has some level of medical accuracy. Who knew?
It seems you have the suds. Are you ready for your treatment?
The doctor's wearing the thing again. What is that thing? What is it doing? And why is there a fish anatomy in the background when there's a sponge patient? Different species.
Well, it looks like your gluteus maximus has made a full recovery.
Oh, his gluteus maximus. They're using proper anatomical terms. I guess he tore a muscle in his buttock.
Your butt's all better. It's really quite amazing.
I love that they did an x-ray. First of all, you can't x-ray a gluteus maximus. You can't x-ray muscles. You can x-ray bones, joints, but not muscles.
It took 20 hours to put it all back together. We actually ran out of staples and had to use a glue stick.
There is a fact here. In closing skin, there are both of those options. For example, if you get a cut on your skull, you can actually close it with staples. It works quite well. If you get a small cut on your hand, we have skin glue that can keep it together. Isn't that cool? SpongeBob, what's up?
Ah, Doctor. Thank goodness you're here.
They're wearing the thing on the heads again. Of humans. He's a vet because they're in a fish tank or at the bottom of the ocean. And there's a catfish that ate some keys and didn't have strep throat, but had key throat.
You solved that one. Subscribe.
Key throat. Oh no, little laryngitis.
Oh, those tonsils are really enlarged, Gerald.
Oh, tonsillitis.
I think we should take them out.
Now we're trying to move away from doing tonsillectomies. We're weighing the risks versus benefits here, and we have like a set of guidelines that we follow. If you have X number of strep throats or tonsillitis or pharyngitis, that we get you set up with an ENT who then makes a decision whether or not they need to come out. Now we're trying to do our best to manage it medically and not have to resort to a surgical operation if we don't need to. That doesn't mean you won't get surgery. I'm just saying there's options on the table. Ow.
What am I gonna do, Arnold?
Maybe if you gargle or something.
Gargling is actually not a bad option. Also, honey. You know I love my honey.
Are you having problems mess with your you-know-what?
No, my giggly gland is fine.
His what gland?
No, it's not. Cosmo's fagiggly gland is
Fagiggly gland. I wonder what the fagiggly gland is.
the special magical organ in a fairy's body that allows us to change shape.
What?
Is Cosmo sick?
Let me put this to you in terms Cosmo could understand.
Yes. Why does the doctor keep putting the glasses on, taking them off, and why is the stethoscope floating? I need And he's wearing that thing! What is that thing? Oh no, Walking Dead again? Why are they all jaundiced?
What the? It looks okay. 986 degrees.
98.6 degrees, normal body temperature?
This morning, our house became infested with an acute febrile contagious virus.
Ooh.
Or as it's known on the street, the flu.
Ooh, the flu. We haven't been seeing much of that lately.
With 13 louds packed into 1,200 square feet, when someone gets sick, it spreads like the plague.
That's true, actually, in like college dorm rooms, military barracks. Anytime you have people living in close proximity, it's very easy for one person to get sick and then get everybody else sick.
In case we're attacked, this concoction will slow down the infected.
What is it, boogers?
Tastes like chicken soup.
Oh.
That's because it is chicken soup.
I would be just shooting that in my mouth all day. I love chicken soup. Little skin pearly papules to pop up. It happens more often in kids, people who share towels. Sometimes they're sexually transferred. Morgan School.
Good morning, class. Good morning, Miss Pancreas.
Miss Pancreas.
Miss Pancreas? Yes, bladder?
That doesn't look like a bladder. That looks like a lemon.
Can I go to the bathroom?
And ironic that the bladder has to go.
You'll have to wait till after roll call.
Oh my God, this is so embarrassing. I remember in like 2nd or 3rd grade, I asked the teacher to go to the bathroom and she said no, and I peed myself in class.
Grammarly for sponsoring this video. Beep-whoop. Hormel introduces new chili formula for mothers who can't produce own chili. First of all, I have to point out mothers don't produce chili. If they did, I'd be working them up for a condition that is probably gonna be named after me because it's never been described in the textbook. Like, let's say they're pregnant and instead of breast milk, they produce breast chili. Chili breast syndrome. CBS! You have a new home! Columbia Broadcasting Station, it's actually chili breast syndrome and has nothing to do with the temperature. American Medical Association introduces new highly effective placebo doctors. I'm about to say something terrible. Isn't that what naturopaths are? Oh, he said it! He said it!
How dare you, sir?
He said it. But this is an Onion video. We're allowed to be comedic. Funsies are allowed. Disney Plus debuts new Star Wars show about Yoda battling testicular cancer. What? Does Yoda even have testicles? Someone is definitely gonna say, like, obviously they just used a lightsaber to go in and gently do an orchiectomy and they saved his spermatogenesis. I probably had to say that out of order. The balls saved within me are of utmost value to everyone around me. Scientists develop even more painful form of female contraception. See, we talked about. Yo, that fake IUD looks fierce and scary. That looks like if an IUD had a baby with a thorn bush or a rose bush. I regularly pick things like that off of the dogs, and it's not an IUD. I promise. New TLC show follows the life of man who is 5 pounds overweight. That is now the future with these GLP-1 agonists. He chooses to skip the gym for the 3rd day in a row and eat a peanut butter and jelly sandwich. That sounds like my last few days. I've been slacking, especially this Father's Day, because you know I am a father to 2 noofs. Glade introduces new meat freshener spray. Ew. An easy way to take the putrid stench out of expired goods.
Are you okay?
You know what's funny? Glade probably has some antibacterial properties because it has some alcohol content in it. At least that's what I'm assuming. But please don't spray your meat to make it taste better. I never thought I'd say that on this channel. Lancome introduces new full-body moisturizing chrysalis? Is that a cocoon? This reminds me of like when all these fitness bros are all in their hyperbaric chambers, cocooning and healing with the high pressure environment. And look, for some wounds, maybe, but for the claims that people like our good old friend Along Came Polly. I know you don't know who Along Came Polly is, and it has nothing to do with the Ben Stiller movie. Along Came Polly is my new nickname for Liver King because Liver King is very obviously still on steroids. I think he's admitted to it now. And one of the side effects is creating a lot of red blood cells, also known as polycythemia vera. So you could see how doctor humor gets lost in the general population and also makes it hard to make regular people laugh on the street. Logitech introduces high-resistance keyboard for fitness. Type it. Yo, I have diesel fingers. No, actually, you know that Marquez on his podcast has a competition where people see how fast they can type the whole alphabet, and he sprung it on me on a day that I didn't sleep and I had no caffeine, or maybe too much caffeine, I can't remember. I still finished like in 8th place out of like 20-something people. Tom Scott, you type quick. I feel like he practiced it. How fast can you type the alphabet? Bausch and Lomb introduce new rib contacts for extra pleasure. That would be like having a foreign sensation in the eye, and that's a legit review of systems thing that would flag for me and I would want to investigate for a corneal abrasion. But hear me out. If you're an alien and you come to the globe, first of all, you look and you just say, what the F is going on here? But then number two, someone comes up to you and says, hey, there's this company. It's called Bausch and Lomb. Eyewear company, condom company. I vote condom. Bausch Lomb sounds condom. Fight me in the comments. Trojan introduces new contraceptive, Fife for charming sperm out of vaginal canal. The small wooden flute, when played correctly, is capable of enchanting up to 99% of spermatozoa, leading to them jauntily and safely away from the nearest egg. Do you think that's how the egg gets the sperm to come to it? It plays like a little melody for them. Drano introduces new shampoo for eliminating drain clogging hair at the source. Oh, your hair slides off right off your burning scalp? But yeah, if it falls off your scalp, it's gonna fall right into the shower drain. They didn't think this through, Drano. And a product like this exists. It's called Nair. One of my very first patients in residency was a patient who overused Nair in their private parts and caused a significant chemical burn. First day of residency. Came in, I was like, let's go. Okay, let's go. Hims now selling bags of chips for depressed, impotent losers who are also hungry. For those who don't know, Hims is a company that remotely sells, I guess, access to telemedicine services and then prescription medications. I'm not particularly a fan of the model just because it creates all these like ethical dilemmas and actually stops patients from talking to doctors about more serious conditions. Like when it comes to erectile dysfunction, when a patient comes in to discuss that, that's one of the biggest signs that something could be going on in their vascular system that's also affecting their heart. So like, the erectile dysfunction is the jumping off point to talk about heart health, whereas if they use one of these websites, it's easy to miss that. You know, I honestly think The Onion has some of the funniest writing on the internet. And while I'm not nearly as funny as they are, I do get some help with my writing thanks to Grammarly Premium's AI tools. You see, Grammarly is an AI writing partner that works where you work, so you can craft quality writing faster across different platforms. No more copying and pasting like other AI tools. After using the free version for years, I've upgraded to Grammarly Premium, which has some awesome new features. Strategic suggestions is definitely one of my favorites because that actually helps me improve my writing. After I finish the draft, I can ask Grammarly to review things and suggest ways to make it more impactful or even clearer to the reader. I'm always trying to make my scripts about complex medical information easier to understand, and Grammarly definitely helps me with that. My speed has also increased significantly thanks to app actions, which allow me to share a script that I'm working on with my producer Sam, all from the body of the email itself. I don't have to manage 50 open tabs anymore to send things to my team. It's such a time saver. 96% of Grammarly users report that Grammarly helps them craft more impactful writing, and I'm no different. Click the link below to sign up for free and then upgrade to Grammarly Premium to level up your productivity like I did. All right, let's get back to The Onion. New hormone-free IUD wards off sperm with steady emission of police grade pepper spray. God, that's gotta hurt. Why pepper spray? Weren't they using like tear gas? For years, patients have been able to choose between a progestin-based or copper IUD, but soon they'll have a new option that leaves sperm burning in pain. I've heard some news on the horizon of a potential male hormonal gel as a form of birth control. If we're running with this idea, I guess it would blind the sperm. And if the sperm can't figure out where they're going, they'd get lost. I don't think it's effective. I need to see the clinical trial data.
Show me the receipts!
Q-Tip introduces new multi-speed electric ear swab. Honestly, this is definitely gonna come out, and I'm definitely gonna have to make a hate video about it. Why are people obsessed about digging in their ears? I know it's the itch you can't scratch, but like, get a massage, go for a jog, create something. Don't dig in your ear. It's only gonna cause a problem. Cartier introduces new diamond encrusted gastric lap band. Oh God, that's gotta hurt. The lap band already like has a potential side effect, but now it's gonna be biting into your pyloric sphincter with its diamonds. Just
Cutting it, bleeding it.
I bet one of the contraindications to the Cartier lap band is being on a blood thinner. The diamonds are so high in probability in cutting your stomach that you have a high risk of bleeding. You can't take blood thinners. Always introduces off-roading maxi pads with 40% more shock absorption. You know who that's for? People who jump on those pogo sticks that have the mono seat and they just jump on it. That's probably valuable. You know what that could be good for? People who go mountain biking. I swear, when I take my like hybrid road bike out in the streets of Manhattan that has really bad concrete, if you want to put this into one of my biking shorts, I wouldn't be against it. Oscar Mayer introduces new filter tip hot dogs for a healthier meat eating experience. We need like Oscar Mayer introduces GLP-1 hot dogs where they have GLP-1 medications inside them that you could take orally without needing an injection. That would be a treat. There's actually a whole line of foods that I believe that are being put out, marketed towards people who are using GLP-1 medications. A full line. REI introduces fleece supplements to insulate digestive tract. For those very cold digestive tracts, keep them warm, keep them soft. I would say it is, why can't I think of the word? It starts with the S. Carafate. Why did I say S? Oh, sucralfate. Sucralfate is basically insulating fleece for your stomach. It coats it, it protects it, especially if you have some like ulceration happening as a result of NSAIDs, non-steroidal anti-inflammatory drugs. Tums introduces new sternly worded note reminding consumers they know better than to eat that stuff. The best method of heartburn relief remains having some goddamn self-control and saying no to that fourth slice of pizza, especially when it's too close to bedtime. So Tums is now in the disciplinary side of things as opposed to the calcium carbonate of it all. When you mix acid with calcium carbonate, it reduces the pH, or it increases the pH, making it more basic. One of the side effects is you burp. Tums can give you gas. Invisalign begins offering clear body shell system to gradually straighten posture. It's like Bubble Boy, but for posture. And you don't need perfect posture. Ideal teeth placement could be beneficial so that you don't develop jaw problems, headaches, face shape changes. But posture should be about physical therapy, not about a pod. Midol introduces new leather strap to bite down during menstrual cramps. Oh, that's dark. There's been a lot of talk how folks are not given enough medication during pap smears and certain other gynecological procedures. Midol would use this product for it. No, that ain't okay. Heinz introduces new quick recovery sports ketchup. Heinz already has electrolytes. And this thing has caffeine. Oh my God, it's like Prime, but on a burger. 3M introduces new line of protective foam eye plugs. They already make eye protection. You don't need foam eye plugs. By the way, earplugs need a redesign. I don't like the whole like roll it in your ear, jam it. Like, can we have an outer thing where I don't need to stick things in my ear? I feel like that just creates earwax problems. 3M, get on it. Cliff Bar introduces new savory Cliff Loaf. I hate the term, the word, the noun, loaf. No one's ever said loaf to me and I went, yum. Tums introduces new deep dish antacid pizza. Oh, what's an antacid pizza? Tums has introduced some weird products like mixed berry Tums. Like, do we need mixed berry? Can it just stay normal? Kotex introduces new confetti popper tampons, ringing in the new year. That's actually a similar design shape. Well done, Kotex. Doctor reacts to video of his own death.
Oh, wow. Okay, so as an ER doctor, I've seen a lot of injuries like this. It's hard to say exactly what is going on.
It's not hard to say. There's a person who has a head trauma, bleeding extensively, is nonverbal, is turning cyanotic, and you need to see if they have a pulse, and if not, you should call for help and immediately start chest compression, chest compression, chest compression.
This hasn't happened to me yet, and it's hard to get a clear view of the injury too because of my wife sobbing over my limp body, which I do appreciate, but the first thing I notice is that I'm experiencing a whole lot of blood loss, which hopefully means I died instantly without any awareness of what was happening.
Hey, keep your eyes.
Jeez. Someone call 911, and quickly, because you can actually see my breath starting to slow down now as the lungs fill up with blood.
And that's a problem, because when your breath slows down in the midst of you losing blood, that means you're giving up. Not by choice, but because there's a problem.
I can feel now that the end is nearing as all the memories and regrets flood my mind. This is probably the point where I would start panicking.
Why does he have a Band-Aid wrong side out on his hand?
I'll scream, no, no, please, not now, not here, not like this. All very common for someone so close to his inevitable demise.
Is this what I'm gonna do to my own death? I swear, if I'm a ghost, I'm gonna do a reacts video to my own passing.
What I'm really curious about is when this does happen to me a few years from now.
You're wearing that same shirt, champ. And the same weird Band-Aid.
The question is, do you think that's inspired from Dr. Mike?
I can't take the credit for it. It's easy. I decided to react to some of the headlines and articles from The Onion. For those of you who don't know, The Onion is a satirical newspaper. None of their headlines or articles are true, so I hope to get a good laugh. Don't get offended. It's comedy. We're here to have a good time. You ready? Excited patient points out organ he wants from kidney tank in hospital lobby. I don't need to read the article. Look at the little kidney floating. Badass surgeon puts on fingerless latex gloves before operating. The dirtiest, meaning the most infectious, full of bacteria and viruses part of your hand are the fingertips. Dr. Scholl's introduces new freeze-away toe remover. Oh, I have this thing. I've actually used it because I had a, wait. It got me. Chicago foot care brand Dr. Scholl's unveiled its freeze-away toe remover Thursday, an over-the-counter treatment that combines freeze therapy with fast-acting liquid to loosen and ultimately expel unsightly toes. Not gonna lie, my toes are looking rather rough during this pandemic. The struggle is real. I'm self-pedicuring. Not good at it. The real product that The Onion is doing a witty satire of is actually a freeze-away treatment for plantar warts. If this specific treatment thingy doesn't work for you at home, we have one where we do this cryotherapy in our offices. I wonder if anyone clicked on this and they're like, ooh, that toe was getting in the way. Health insurance CEO reveals key to company success is not paying for customers' medical care. Just the other day, I had a patient, I prescribed them a medicine for a common antibiotic, send it into the pharmacy. Pharmacy says insurance not paying for it. I'm like, what? It's like one of the most common antibiotics. Get on the phone, spend half an hour arguing with the insurance company. And what do they tell me? Oh, it's because you ordered the capsule version, not the tablets. If you just ordered the tablets, it would have been fine. You owe me half hour of my life back. Tips for finding the right doctor. Just by the photo, I'm already excited for this tip. Ask yourself what your personal goals are when you see a doctor. Do you want to live or die? Do you want to prevent illnesses or contract them? The goal is to live, and the goal is to have the least amount of illness possible. Doctors can provide better care when they treat your whole family, so try to get the same primary care physician for your spouse, children, and pets. I was gonna say, this is a good one. And then they threw in pets. A skilled physician should be able to detect any potential health problems, so never tip them off by revealing any of your symptoms. No, we need your help. The history is probably the most important part of the exam, with the physical being the second most important. I guess it depends on the illness I'm trying to diagnose. Ask them straight up if they've ever killed a patient on purpose. Hey, doc,
You ever did that to a patient? Tell your doctor your kidney hurts. A good one will know that that's not a real organ. A good one will know what you mean. No. A good one will know to ask what you meant without sounding judgmental. Other patients can be your best allies when it comes to finding the right doctor. Agreed. Ask friends and coworkers if you can sit in on their physical to get a feel for what their doctor is like. HIPAA. Make sure they have kind eyes that crinkle at the corners when they smile. Aw, does your doctor have crow's feet? That means they care. Many healthcare professionals are increasingly rigid when it comes to prescribing medications. Remind your doctor that with a couple of bad online reviews, you can bring it all crumbling down. Man, this is so true. People that run their own businesses, they're between a rock and a hard place. If a patient comes in requesting a specific treatment or a specific test, and the doctor doesn't think it's in the patient's best interest, but the patient threatens them with a bad review, what are you left to do? And you know what the worst part is? Let's say the patient leaves a fraudulent negative review. Says the doctor did so and so, and the doctor knows it's untrue. They can't go on and say that because of HIPAA, patient privacy. Above all, don't put too much pressure on yourself. You'll meet the right doctor when you're ready. Sounds like a dating line. No, in all seriousness, it's really important to find the right doctor because if you have a healthy doctor-patient relationship, you're more likely to have better health outcomes. And if the first one isn't right, always look for a second opinion. I'm in witness protection, I mean doctor, I work at doctor, says neighbor.
What?
I'm in witness protection, I mean doctor, I work at doctor, says new neighbor. Anybody?
12 seconds later.
So he's covering up.
Got it, okay.
No, it's just no better.
I need to do better. Grandfathers accidentally switched to hospital. In yet another disturbing case of hospital negligence, 2 elderly grandfathers were accidentally switched at Cedar Mount Sinai Medical Center in Los Angeles and sent home with the wrong families. I think this was poking fun at the fact that back in the day, people may have taken the wrong babies home, but nowadays, we have a lot of security around taking the right baby home. Moms and dads get security bracelets that if the baby is approaching one of the exit doors, they won't open unless the father or mother have also their security bracelets on. So no one's taking the wrong baby home, nor are they stealing one, but the elderly, that's funny. Russell Westbrook quietly asks Rockets team doctor if he needs to make free throw to pass physical. Why? Is he so bad at free throws? He's like 70%.
62.
That's pretty bad. Nutritionists reveal humans with proper diet should not be defecating. What? Pooping is great. Urinating, great. Are there unhealthy poops? Yes. Are there unhealthy urines? Urinations? Yes. But that's a question for your doctor. You know what I'm worried about? An article like this gaining traction on like an Alex Jones podcast, and then people being like, oh man, and here I have been for 45 years pooping my whole life. What have I been eating? Doctor asks patient if he would mind having medical student, some of his poker buddies in room for exam. If you've never had this happen to you, before I bring in a medical student or a resident with me when I see a patient, I always ask for permission. It's the right thing to do, it's the polite thing to do, and actually I think there's rules for it now. How funny would it be if your doctor walks in and is like, can I have a medical student? You're like, sure, and you're like, what about some poker buddies? And the people that they put in, the guy with the glasses. So I used to play poker semi-professionally back in the day when there was Full Tilt, Ultimate Bet, Absolute Poker, Poker Stars, all those good times. I don't understand why people, when they play live poker, they wear dark reflective glasses. It's like they want you to see their cards. US dentists can't make nation's teeth any damn whiter. You know, there's like something that happens internationally where they actually make fun of Americans for having 2 white teeth. They actually make it a joke to say, oh, you Americans with your white teeth. I do think that we go overboard when people do veneers and stuff. They bleach their teeth white like porcelain, but sometimes it's too white. Like it looks artificial. I will say that if you over bleach your teeth, it will make your teeth sensitive and it will hurt. So please be careful. This has happened to my friends. It's happened to myself when I was younger. Made the mistake, not happening again. Exhausted doctor to wake up early, finish surgery. in morning. Just moments after successfully stopping his patient's heart at 10:30 p.m. Tuesday, bleary-eyed surgeon Dr. Dennis Kelly called it a night and decided to finish performing quadruple bypass surgery on Harold Cruz, 67 in the morning. Honestly, all these organs are looking the same to me right now, said Kelly. This is actually a legit struggle. Some surgeries go on for hours, pretty much the entire day. That is why we have teams of surgeons and surgical residents that help out in specific operations. In addition to that, we always have a backup surgeon on call in case the surgeon starts feeling unwell, gets sleepy. ER doctor excitedly tells wife he got to use shock paddle thing today. I love the picture of the doctor. I've been wanting to play with those thingies since my first day and I finally got to. I put them on the guy's chest, yelled clear, and they went bzz, just like they do on TV. It's called a defibrillator. We have to start this segment this way. Chest compressions, chest compressions, chest compressions. You don't run for the defibrillator until you start doing chest compressions first, after of course you call for help. But you can call for help while you're doing chest compressions. The reason we do chest compressions is because you need to buy time for the defibrillator to get there, to turn it on, to make sure it's working, all that good stuff. Health scare prompts man to start overeating healthier. I love that how that sounds. That's a giant plate of food. It looks healthy, but there's a lot of it. This has been a real wake-up call for me. So from now on, I'm sticking to eating only nutritious, low-fat foods well past the point of being full.
His physical limitations.
That's actually a really important factor in the success of any medical treatment. If your medical team is well versed on your chart, the chance of a mistake occurring drops down significantly. And by the way, patients need to take some initiative here on their own to know what medications they're taking, to be interested, ask questions, advocate for themselves. If not themselves, their family members advocate for them. Because I can't even begin to say how many of my patients come in taking 10 different medications, not knowing what they're for, what their dosages are, and that's a mistake waiting to happen.
I have some news for you.
Oh, this is our guy from Walking Dead, and he looks like Louis Espina from the channel, by the way, does he not? Oh, he was in Magic City, one of my favorite canceled TV shows.
You're getting a heart, Denny.
I don't mean to be dramatic and all, but I'm gonna need you to repeat that.
He looks and sounds exactly like Espina, it's crazy. What's the weirdest reaction you had from a patient in doing a prostate exam?
I've had strange sounds. I had one guy almost break my finger off.
You are getting a heart.
I'll give you my heart, too.
What the hell happened to my donor?
He went into VFib.
I can see
Oh,
that.
no.
Give me the palace. Grab, take over compressions.
Okay, please don't shock the flatline patient.
He's asystolic. I don't get it.
He's asystolic because his heart is no longer having any electrical activity, and you trying to restart his heart by shocking is not how it works. You give the epinephrine, if not, it fails, it fails.
Just because your donor's heart died doesn't mean I have to give you mine.
Is your patient higher on the transplant list?
I have no idea.
The way that they decide is based on proximity, matching, obviously, and matching includes HLA typing, blood typing, cross typing, and then one of the most important things for a heart is actually the size and shape of the recipient's chest cavity. So imagine you have a very small person getting a very big heart. That heart may not be able to beat properly, and therefore it's not a good match.
As of this morning, Dr. Hahn's patient was 22/100ths of a point ahead.
That's basically a tie.
Point ahead based on whose scoring system. I know, like for liver transplants, to put people on a list, there's actually scores that we use called MELD scores. I forgot what the other one is called. For heart transplant, I wasn't even aware that there was a score.
And there were 2 donors, Izzy. Our guy's heart flatlined, and now he's trying to get the other guy's.
But there's a list.
Yes, then the higher guy gets the heart.
Denny's getting worse by the second. His sats are now in the 70s and dropping.
Izzy, I'm not gonna lie for you.
I understand advocating for ones you care about, but you can't lie. This is like the equivalent of killing someone else.
Did you put him on a nitro drip?
Yes. Yes, of course.
She could be putting paddles directly on his heart. He's still not getting this thing.
The amount of animosity in this hospital is bewildering to me. The fact that one doctor is like, I don't care if you're a patient on the deathbed, you ain't getting my heart. And then the other person is just making it up and acting like their patient's dying when they're absolutely not. What is happening?
Dr. Hahn.
What?
If Dr. Burke wants to run labs, do an echo and a BNP to fully ascertain the status of his patient, we'll allow it.
That'll take an hour.
That's gonna take longer than an hour, by the way, especially in most busy hospital systems. Getting an echo means getting a tech, then getting a cardiologist to read it. Like, that's just not gonna happen stat.
He'll get the next heart.
No, he needs to get this heart.
He'll probably get a heart at some point, but as long as Danny's doing well on the LVAD and there's someone ahead of him on the transplant list, he's not gonna get this heart.
They're almost saying it as if like, honey, we have to follow the rules. No. This is the right thing to do, rules or not. The person who is in active danger deserves the heart, not the person you want to go on the date deserves the heart.
You're right. Okay. Thank you.
If she starts poisoning him, I'm gonna lose my mind.
In order for you to get the heart, you would have to get worse, much worse, and you would have to do it very quickly.
Well, I don't see that happening. You see that happening?
I am gonna make it happen.
I had Grey's Anatomy on my list. I don't remember where it was, but I just demoted it. Retroactively, I'm gonna go back into that video and demote Grey's Anatomy after seeing shit like this. Katherine Heigl deserves to be like the evil version of House MD that doesn't try and secretly make their patients better by being unethical, but just secretly wants to kill her patients by being unethical.
Don't worry. You're not gonna die. I will be here the whole time.
Oh my God!
Make sure of that, and that's what this stuff is for.
I didn't expect this.
All right, this is wrong.
You've waited 1.5 years to get this thing. Who knows when the next one is gonna come along?
Is this how she gets kicked off the show?
Please? Okay, I can't do this if you don't. Please, if you don't do this, please.
Okay, I'll do it.
You know, like when a conversation goes too far and you have to like walk it back? I'm gonna walk this back. You have 2 patients that need a heart. There's only 1 heart available. One patient is actually sick, but the other patient who's okay and stable waiting for a heart is in love. And because they're in love and their manipulative doctor, girlfriend or person, whoever they are in this relationship, wants the heart so bad that they're actually gonna screw over the person who's dying in order to get the heart and lobby for the heart to come to their lover. Holy sh**.
Okay, after I do this, I might have to shock you a few times.
Do what, Izzy?
I feel like we should say stuff. Denny, do you want to say stuff?
A person is actively about to be murdered, and this other resident, George, has no qualms about this? Unplug it! Why are you cutting it? You cannot reconnect the cut. She's not even a good lawbreaker, man.
All I have to do is confirm that his condition is worse, and then Burke can call UNOS, and he'll move up on the list, and he will get his heart.
She's gone insane, right? It's not just me?
He's been shot.
What? This is a comedy. This is... I don't know if the writers deserve a raise or someone should take away their Adderall because this is a problem.
This is bad. This is bad and serious and against a lot of rules. It's not fun for me. I don't want to play.
What if you remain?
Well, I wouldn't have fallen in love with a patient.
You fell in love with an attendant.
What's so to bear? What's the point? The point is we can't help who we fall in love with.
Okay, I think this is a point that I have to say. This doesn't happen in hospitals. This is the equivalent of saying that like that crazy story that happened on Netflix with the murdering nurse, that happens everywhere. No. It doesn't happen everywhere.
How's his heart looking?
His left ventricle's shot and he's barely pushing blood out.
When a heart starts having a very low ejection fraction, that puts you into a risk for developing arrhythmias in the heart, potentially fatal ones, because then you're not able to adequately supply the heart with the blood that it needs to function and keep beating. Because remember, the heart's job is not just to pump blood to the body, but also to itself. And actually in patients who fall below a certain ejection fraction threshold, they actually get something known as an implantable defibrillator that if their heart starts failing so bad that it stops or goes into an abnormal rhythm, it actually shocks them back.
I love him.
You don't even know him.
I do know him.
No. You've never even seen him outside the 4 walls of this hospital. You don't know him.
I know him.
Do you know who should be most afraid of her? The dude. Because if she's willing to kill you for love, do you know what she's gonna do if you try and break up with her?
There's possibility here. And given the choice of running or staying,
You should run. A sane person, a person who values her career and everything she's worked for.
How about the other person's heart? How about humanity?
The same person would marry me.
He's hypoxic. He doesn't know what he's saying.
He said, marry me, right?
He did.
Danny, wake up. Danny.
Wait, stop dying and tell me you want to marry me. Ah!
He's flatline. No, he's not flatline. There's movement in his heart. Okay, let's shock him. Charge the defibrillator.
They don't even know what rhythm is it. Is it shockable? Is it not shockable? But let's shock him.
We need that medicine.
What medicine?
I'll know it when I see it.
I think the one that stops the heart. Here, hold
Atropine?
All part is keep my heart beating.
No. It only stops your heart for 6 seconds.
Adenosine, sorry.
Adenosine.
Adenosine is a medication that we use to break supraventricular tachycardia, which is the SVT that they just mentioned. And basically, it's a pretty scary medication to give because when you give it, it actually completely stops the heart and allows the heart to restart, and sometimes it could break it. There's also some unique things that we do to try and trigger a breaking of an SVT, like dunking a patient's head in cold water, like I'm not even joking, or having them try and bear down and do Valsalva maneuvers. Kind of interesting.
It's okay. It just feels
I'm gonna die.
You're not gonna die, I promise.
That feeling of impending doom does happen with adenosine. Yes, he flatlines for a few seconds and then it should come back.
You fools better have a good explanation for this.
People in medical school and residency would throw you under the bus because you came 4 minutes late to lecture. Here, their residents are so tight-knit that they'll help prevent a murder to help out a romance in the hospital.
He's gonna get the heart, right? You're gonna sign the charts and talk to the transplant coordinator.
Here are the labs.
I'm gonna guess that his BNP is significantly elevated. On his echo, he has a worsening ejection fraction. And if they did a chest x-ray, they're gonna see significant pulmonary edema.
See, his BUN and creatinine are increasing.
Okay, BUN creatinine because his kidneys are failing.
He clearly has pulmonary edema. He deserves to move up to 1A status on the transplant list.
Okay, by the way, BUN creatinine is not what decides pulmonary edema. Pulmonary edema is decided by a chest x-ray, so this is complete horse poop. Oh, and by the way, I keep saying BNP, but I'm not defining it. BNP is brain natriuretic peptide, but it's a marker that is released when there is significant strain on the heart, and a lot of times it is reflective of when a heart is failing, signaling that there's worsening of congestive heart failure.
Look at that thing.
Yeah, the left ventricle is excessively dilated.
When we talk about congestive heart failure, a lot of times we talk about an enlarged left ventricle. The left ventricle is the part of the heart that actually sends blood to the rest of the body. So when that part of the heart can get actually too big, it hypertrophies, it doesn't fill and relax as well in order to fill with blood and then send blood to the rest of the body, including the heart. So there's two types of dysfunctions when it comes to heart failure. Systolic heart failure, when the heart can't pump as well, and then diastolic heart failure, where the heart can't relax as well. Both are big problems, slightly for different reasons, but the treatments, medication-wise, change depending on whether it's systolic or diastolic heart failure.
You look... God, you look amazing.
Is it bad that I secretly want him to break up with her right now? And then she goes into cardiac arrest from stress-induced cardiomyopathy like Takotsubo, and then he has to do CPR while the rest of the rescue people arrive? That would be really funny. He's flatlining. Why is no one being notified of this? Why isn't the monitoring alerting anybody? If he just had a heart transplant, he's in the cardiac care unit. At the very least, he's hooked up to telemetry and someone is being notified of that.
I think it was a stroke. He was prone to blood clots. A clot could have formed on his sutures, traveled to his brain. It only takes a second.
It could have been a lot of other things, but you know.
Take out the branch! Can't take out the branch, you'll bleed out.
That's good advice. You never want to take out any object that's inserted into you or gets impaled into you. Taking out the branch is a bad idea. If someone's bleeding out, the first thing you want to do is apply as much pressure as possible. If that's not working, you have to create a tourniquet. And a tourniquet can be made from anything. You can rip off a shirt sleeve and wrap it around the area. Just remember, you have to go closer to the body with the tourniquet from where the wound is. So for example, if the wound is right here, you want to put the tourniquet on here.
His renal artery is cut. I'm gonna clamp it. We're gonna use his blood. Start a line. Go, 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 go.
Maybe this is something you learn when you're learning about war trauma. This is not something I've ever been taught. This sounds ludicrous. It looks ludicrous. It's giving me the heebie-jeebies. I hope no one does this as an EMT. Patients go wild like this. It happens, especially those under the influence of drugs, alcohol, that sort of thing. This is heavily underreported. Healthcare worker abuse, whether that's nurses, doctors, PAs, pharmacists, whoever it may be, get abused often, and often meaning more than it should. And it doesn't raise any headlines, it doesn't raise any alarms, but it needs to. We shouldn't have to have patients yelling at us and punching us and threatening us and throwing things down. Between doctors and administrators, definitely exists. I wouldn't say it's this bad. Generally though, everyone has the patient's best interest at heart. Not everyone is so money hungry as they're making this gentleman out to be. They definitely think about profits more than they should, but I don't think they would ever put in jeopardy a child's life, especially a baby's life. The difficult part about being a hospital administrator is that you are constantly forced to make a decision. Let's say keeping the baby will cost you so much money. These types of losses will become larger and larger, and then the hospital will be forced to close down. You're hurting thousands of people, if not millions of people. I don't know how many people come to this hospital, but it's a tough decision. It's not an easy position to be in, so I don't envy that job. But like I always say, be a human first. Hospital administrator, doctor, whoever you are, human first. And taking out the bullet is not the most important aspect of treating someone, because just taking out the bullet doesn't stop the problem that's going on with the patient, and that's bleeding. So you need to control the bleeding, and in order to control the bleeding, you need to find the source of the bleeding. So pulling out the bullet is one step, but there's a lot of people that still have bullets even in them because we stopped the bleeding and there was no medical need to take out. Being too altruistic. And there is such thing as being too altruistic, is you become an idealist. And at times as a doctor, you can't become an idealist. You have to be rational, you have to be practical, you have to be quick thinking. If you constantly put your hospital in the red because you either over-order tests or you perform procedures that won't be covered by insurances, you can bankrupt the hospital system and force the hospital system to close and then hurt so many more people. In Atlantic Health System, Overlook Medical Center, where we have a fantastic charity care system, that if someone makes a small amount of money, is uninsured, they can almost be seen for free. I mean, some of the charges, like to see a doctor is like $10 or $5. They're very low. If you're ever faced with this dilemma, you don't have insurance, you think you should get checked out or you want to get checked out, it doesn't mean because you don't have insurance, nobody's going to take care of you. Figure out a way to get seen. Talk to social workers, talk to government employees. There's usually a program that we can tap to get you the help. But I agree here, in Afghanistan or in a war zone, you have no choice. If you don't act, this person dies. So even if you're not giving them the best quality care, you're doing the best that you can in that moment to save their life. But in a time where you pull up on the side of an accident, non-sterile, the best thing that you can do for the patient is get them to a hospital as soon as possible, not to perform surgery in the woods. In any hospital, so I'm curious what's gonna happen next. Because he went, bam! I don't know why I'm so frustrated with this show. He was a doctor in Afghanistan that performed neurosurgical procedures / surgeries and was bad at them because he wasn't trained to do them. It doesn't sound surprising to me. I don't follow the logic. This show is not for medical folks. I know. Make mistakes. You have to treat everyone, whether or not they're a criminal, not a criminal. It's not your job to figure out who's right and who's wrong in each situation. As a doctor, you take the Hippocratic Oath for that exact reason. You will treat anybody, regardless of their race, religion, criminal status, not criminal status, war criminal, not war criminal, everybody. You can't be deciding and playing God who you are and you aren't saving. Just imagine the pitch meeting for this TV show. It's like, we need a very rare condition for this young girl to have where she has some sort of other human being living inside of her. I've heard of stories like this before, but they were just a case study, which just means one person out of millions that have this condition. It's a pretty rare condition where basically the tumor is your twin that died but didn't survive, but still lives inside in this little tumor. Well, lives is a bad term. There's also tumors that exist known as teratomas, which basically arise from the cells in your body which are responsible for growing specific other types of cells. So within a teratoma, it's not unusual to find fingernails, hair, really abnormal stuff, and these teratomas can form anywhere. Imagine finding teeth in your arm. That's what a teratoma is like. It's pretty cool. Well, that was not a medically accurate show, but it was quite entertaining, lighthearted, fun, and I could see why a lot of people would enjoy it. So I appreciate you guys sending me the recommendation. I will have to say there's not a lot for me to comment medically on this episode because the conditions that occurred here were very dramatic and rare, and the way that they perform some of these things is just not realistic and not how most hospitals would handle things and administrators would handle things. But, you know, it's a fun, upbeat show, and it's like a hoorah army show, and I dig that. I'm all about supporting the troops. If there's an episode that has more medical stuff that you think is questionable in its accuracy that you want me to look into, please leave it down below in the comments, because you know I'm all about taking your suggestions. Click that subscribe button down below and make sure.
Doesn't look too bad, all right? You're gonna be all right.
Good triage.
45-year-old male, left leg amputation.
Treatment 2, Trey Motorman, GCS3, BP of 90 by PAL.
GCS3 is the Glasgow Coma Scale. 3 is very bad. You need to be intubated. You're basically in a life or death situation at that moment.
He keeps biting down. I can't get the blade in.
If you can't insert a tube to help someone breathe, the one thing you can do is you can continue bagging them. That still oxygenates their airway. It's obviously not as ideal as putting an endotracheal tube in, but the most important thing is CPR, chest compressions, chest compressions, chest compressions.
Almost there. It's not time yet.
Never ideal to do chest compressions with one arm like that, but I can understand if he's been doing chest compressions for 15 minutes. It's really tough. It's tiring to do chest compressions. I've done chest compressions for a while, and generally after each round, you have a student or a resident standing behind you ready to jump in and start doing the chest compressions, because it's all about at least getting 2 inches of compression to the chest, which can sometimes break ribs, but it's all about getting them enough time to get to the hospital to hopefully save their life.
I got it from here, man. Nope, he's mine.
Type and cross, again, you're trying to find out the correct blood type. For now, giving O negative is fine, but you don't want to keep wasting the O negative blood, so you want to do a type and cross. When he says the rainbow of tubes, that's basically tubes that are sent off for a wide array of tests like CBC, which is a complete blood count, BMP or CMP, which is a metabolic panel, a PT-INR, which shows clotting abilities, and clotting is it's a deadly illness, unfortunately, and it basically, you build up so much mucus in your airway because you cannot clear the mucus out of your airway as efficiently as someone who's healthy and doesn't have cystic fibrosis. So you get very often lung infections, obstruction in your airway, and most people live somewhere into their 40s or 50s with the illness, and that's pretty much a life expectancy. Difficult situation. I mean, to have someone be a surrogate to carry your baby, and then they're living with you and they're involved in this horrible accident and they have a traumatic brain injury where they're being kept alive by machines. That's gonna be a tough decision whether or not to keep her alive using machines so that the baby can continue growing and get to at least to a stage where the baby can survive on its own following a C-section. Of intubating someone who has such a strong acidosis is when you put the tube in, it allows the person to not work to breathe so heavy to expel all that carbon dioxide. The machine basically does it for them. And again, it allows them to rest, it allows the antibiotics to do their job, and it improves the pH quicker than the person can do themselves. Very uncomfortable, not a lot of patients like it. I've never seen, and again, I'm not a trauma surgeon, I'm not an ER doctor, but I haven't seen options given that frankly to patients. If a pH was that low in my hospital, generally we would strongly advise the patient to intubate them. But again, I'm not a super specialized in this field, so I'm just going off based off my own experience. What happens after an injury to the brain is just like any part of the body, there exists inflammation, swelling, edema, and the problem with having swelling inside the cranium is that the cranium's a skull. It's meant to keep things from coming in and protect you, but it also crams the brain when there's edema and swelling, and it actually damages the brain further and can be fatal. So you try and control it with medications. You try and give the patient something to reduce the swelling in the brain. There's also some physical things you can do, like elevating the head to hopefully get some of the fluid to come down. But in reality, if the condition gets worse, you need to do the surgery to open a piece of the cranium to allow the brain to swell and not cause increased pressure within the brain. To the heart of the issue of patient autonomy, that they have the right to choose what happens to their body. I don't know how old Jamie is. Once you're at the age of 18 or older, you have the right to turn down medical treatments. You have the right and say that as long as you understand the consequences of what you're doing, You can undergo or skip any treatment that you want. Nobody can force treatments upon you. I understand what the ER doctor's doing. I also understand what the psychiatrist. Sometimes when you have a direct injury to the heart, that can cause a contusion, which is just a bruise. And sometimes that can mess with the electrical activity of your heart and cause you to have a cardiac arrest, which means that it just stops the cardiac rhythm. Actually, this is a common scenario during baseball games. If someone hits a line drive and it hits someone in the infield directly on the chest, if it hits in a specific time of the electrical rhythm, you can actually stop the heart. Ethical here, they're talking about the patient's condition to a non-family member. It's technically breaking information protocol, but I don't think they're gonna get in trouble for this. I think they're doing the right thing. And that's why a lot of rules are open to interpretation. And I think here they're looking out for the best interest of the patient and maybe telling his patient information to somebody else, but in hopes to save his life. So I think legally this isn't right, but I think morally and ethically it's the right move.
Going back to the hospital.
This is a good show, quality actors, quality script, good medical info, showed some very unique situations that have inherent drama built into them, but they were realistic. Based off this pilot episode, I'm definitely a fan, so thank you for recommending this. If there's another medical show you wanna do, drop it down below in the comments.
See what he's up to, see how the Penny Challenge is coming along. Let's watch some Ryan Trahan content. Be-woo!
50 hours starts now.
50 hours in darkness. That's serious.
It is completely dark in this house. Blackout curtains, all of the lights have been covered up.
The way your body adapts to darkness is by allowing your iris to relax the muscle surrounding your pupil, opens it up right there. Your pupil's wide, allows maximum light to come in. Remember, it's the rods in your eyes that are responsible for night vision, darkness vision. But if you want to have perfect adaptation to darkness, it takes a few hours. Oh, that's gonna be an injury. He needs a doctor. I'm here for you, Ryan.
As you guys know, it's take no days off around here.
Working out in the dark is not medically recommended. That could potentially cause a lot of injuries. See, I wouldn't do this with weights. I would just do the body weight exercises. Push-ups, crunches, squats, lunges, that sort of thing.
Nighttime routine. Haley actually got me a bunch of new skincare, so I look forward to my nighttime routine.
How did he know that was his toothpaste? Something about that is fishy. If you have a nighttime bag with a bunch of creams and stuff, how'd you know that was toothpaste? Oh.
That's facial cleanser.
How did he know that was facial cleanser? The security camera caught me at 3 a.m. I don't remember. Oh, sleepwalking. That's funny. This is actually fairly common. Not eating 5 bags of fruit snacks. Sleepwalking happens during the non-REM phase of your sleep. Usually happens an hour or two in. It's the deepest stage of your sleep. People don't remember it. Usually someone else has to alert them that it's happening. And studies show like 1 in 2 people get injured sleepwalking. Could be a minor injury, but they still do get injured. You wanna make sure that if that's happening, you figure out the underlying reason as to why. Stress is one of the leading factors.
Right about now is when time just completely stopped being a thing for me.
So not having exposure to light can actually break your circadian rhythm, your natural circadian rhythm of when you wake up, when you go to sleep, because there's sensors in your brain, your eye, that get triggered by light entering. So that's why I always say that one of the first things you should do in the morning upon waking is opening shades, getting bright light. And I know not every area in the world has access to that. So you could fake it with some artificial light. Testing if I'm still lactose intolerant. Oh, this is gonna be a brutal test. You know, it's funny, a lot of patients will come see me in the hospital and be like,
am I lactose intolerant?
I'm like, if you drink a quart of milk, do you have massive diarrhea? That's your answer.
Plowed a slice of cheese, and then I ate yogurt and butter and cream cheese, and I remembered I didn't even like most of it. It finally demolished a cup of milk. Now we wait. I was waiting for about 30 minutes when the unimaginable happened. I sprinted to the bathroom, and my chihuahua was sitting on the toilet.
That's a chihuahua? That's a hairy chihuahua.
And I'm still lactose intolerant.
Yeah, that's a lot of diarrhea. Can only imagine the sounds that came out of that bathroom.
Do you overcome a lactose intolerance?
Some individuals can eat certain dairy products. Some can drink milk, lactate, and some can take supplements, like a lactase supplement. Doesn't work for everybody though.
I don't think you realize how crazy the world's quietest room really is. Apparently 30 minutes inside will drive you completely insane.
I've never learned that in medical school.
For reference, a school cafeteria is roughly 100 decibels. A football game, 125 decibels. That's really loud. And the world's quietest room must be so quiet. It's -9 decibels.
How do they pull out decibels?
What you'll begin to experience right away is the sounds of your ears. When you're in super quiet, you begin to hear buzzes and whooshes.
Blood flow.
By a half an hour, you'll hear your heart easily. You'll hear your ears getting louder. You can hear the joints in your arms and legs.
So far, I've heard all of the things he's mentioned, but now I think I'm hearing blood flowing to my brain.
That happens.
What do you think would be harder? 1 hour in the world's quietest room or 1 hour in the world's loudest room?
The world's loudest room? Why would you do that? You're gonna hurt your hearing.
The reverb room reflects each note and distorts it so much that the music eventually just becomes an awful, never-ending screeching noise.
Wow, that's cool.
A reverb room is a room that's pretty close to 100% reflective. And so no matter where you are in a reverb room, it doesn't get any louder or any quieter. It's a perfectly diffuse room, which means the sound is the same everywhere.
That's terrible. He's gonna lose his hearing.
Oh my gosh.
You could permanently damage your hearing like that.
I just damaged my ears. Can noise make a dude die? Yeah, it can. Apparently the European Space Agency has a sound weapon that if they wanted to, it could put you in a coffin.
Well, there's LRAD devices that are used for crowd control purposes. It does make people physiologically ill.
I just put on this sauna suit, I am drenched.
Well, people use sauna suits for cutting weight, specifically wrestling, boxing, MMA, that sort of thing. Not a huge fan of it. In fact, I wish the sports would change the way the weigh-ins are done to be done on the same day so people don't cut weight.
I'm gonna be wearing this for 24 hours straight. I live in Texas. That sun right there, absolutely.
Oh, that's dangerous. You could easily not only dehydrate, but develop heat stroke, which heat stroke is deadly, like legitimately deadly.
Is it a 24-hour challenge?
Yeah.
Have you consulted a doctor?
Haley, I called the doctor.
I'm right here, bro. Just call me.
Dr. Mike.
The doctor's on call.
I need to ask you what you think of this, all right?
I'm feeling the outfit. It looks fire. Is that the new Versace line?
The worst joke ever. How did I think that was funny? That's clearly Gucci.
Medically, it's not safe.
Oh, dear.
Because unlike going into a sauna where you sweat and your sweat can actually evaporate, thereby cool you off, that sauna suit will prevent the cooling off process.
That guy knows what he's talking about.
So you will sweat, you will become dehydrated, you would lose some electrolytes, and you will overheat.
I better go get some water, huh?
Not just water, electrolytes.
I lift up my arm and a massive pool of sweat trickles down my armpits and into my nether region.
Fungus!
I've went in a sensory deprivation tank and did a whole video on this. It's silent, it's dark, and you're floating. Kind of feels like an alien movie.
I'm gonna be doing the maximum legal time in this thing, 3 hours. One with no gravity, one with no gravity or light, and one with no gravity, light, or sound. Complete sensory deprivation, which apparently can have some side effects.
Yeah, those things can happen, but there's a lot of good effects as well that can happen. I will say, going to these sensory deprivation things, my biggest issue with them is that they make way too many promises as if they're certified. 1 hour in a sensory deprivation tank is equivalent to X number of years of meditating, which is nonsense. Making promises about rejuvenating one's immune system or sleep cycle. Like, taking a break from your phone is beneficial. Being alone with your thoughts is beneficial, but making crazy health promises? Too far.
You guys know I can't swim, really. Well, I can't float either. I am negative buoyant somehow. So these pools have tons of salt, like 2,500 pounds of salt. And salt makes you float.
It does make you float. It also makes it a problem if your eyes if the water gets into your eyes. They usually give you like a little floating pillow as well. And I remember the one that I went to had like an emergency escape button to call for help.
Around 2 hours and 4 minutes-ish is where something actually crazy happened. I really feel like my mind was the only thing working at this point. I suddenly felt like I infiltrated this memory that I haven't thought of in years because I felt so still.
Well, for me, I had a similar experience, and I would start like seeing different colors and brainstorming much further than I usually do.
This was my body while running 80 miles per week and eating 3,000 calories a day.
Yo, my man is ripped, and he's running 80 miles a week? Woo-wee!
This was my body while only lifting weights and eating 4,000 calories a day.
Well, yeah, if you eat a lot of calories and only lift weights, that could be a problem. I mean, it depends what kind of calories you're consuming. Remember, macronutrients matter here.
I wanted to know what would happen if I only do bodyweight workouts in virtual reality. Yeah, VR, for 30 days while on a strict diet of 2,000 daily calories and a goal of having fun.
Well, that's an important goal, because when you're trying to change your body, if you're not having fun, it's gonna be temporary. You wanna develop good habits here.
It's day one, and it's time for weigh-in. All right, here we go. See, 157.7.
Ideally, you wanna do that in the morning with no clothes on to get the most accurate measurement after you've peed and pooped.
Oh my God, dude!
Oh, this is,
what the?
Is this Beat Saber? Oh, this is giving me a headache.
What the heck is this?
By the way, I've played these VR games. I get so dizzy.
This is actually so scary. What's up, boy? Get back!
Oh my God. Oh my God. Are we gonna have Ryan Trahan on Creator Clash 2?
Day 12, he's eating a burger.
Out of everything, the diet is the hardest part.
Diet is the hardest part, and it's the most important part when changing how you look.
Oh my gosh, 150 flat. So here's the before and after. Honestly, I would give most of the credit to my transformation to the diet.
Of course, you cut down from eating 4,000 to 2,000. That makes sense.
This is a penny.
1 penny challenge time.
And I'm gonna use it to cross America in the next 30 days.
And he's coming to see Jimmy.
Rule number 1, all profit must come from the penny.
All power must come from the penny.
Big overarching goal for this series is to raise 1 million meals with Feeding America.
He does it. We did it.
I look like Mr. Krabs.
My man got sunburned already. Put some sunblock on, dude. Even if you use sunburns throughout your lifetime, increases risk for skin cancer. You're out in the sun, put on sunblock, Ryan. I'm only yelling because I care about your health and I don't want you to get skin cancer. By the way, sunblock is not the #1 protection against the sun. It's shade.
But if you want to donate the incentives, this.
Yeah. 100,000.
McDonald's. I'm gonna treat myself to a deluxe breakfast this morning.
Well, see, this is like the unfortunate reality of the United States. Like, if you want to save money, eat cheap, you oftentimes have to eat unhealthy.
Chipotle.
I love Chipotle.
Oh my God, I love Chipotle. Chipotle is my life.
By the way, something I never say, and I probably should, Chipotle always hooks up my graduating residents for their party with like a catered Chipotle meal for free, because that's awesome of them.
I'm gonna take a break and eat a burrito.
My order is usually a burrito bowl. Brown rice, black beans, chicken, fajita vegetables, romaine lettuce, the non-spicy tomato thingy. What is it called? Salsa? Oh, and guac.
McDouble, maybe? Okay. Cool. Can I just get that with cheese and ketchup only?
This is not a healthy way to eat. Please find healthier ways to eat, Ryan. I care about your health. We need the veggies.
Can I get 2 McChickens with no vegetables?
No vegetables? You're gonna pay for that.
Oh, with white rice, chicken, and shredded cheese. White rice, chicken, and cheese.
Dude, fiber. There's veggies right there. They're fresh. They don't even cost extra. We're gonna get Ryan to eat some veggies. You know.
So last night before bed, I went to Ralph's. I went to a grocery store, and we got goldfish, rainbow goldfish, protein bars.
What kind of protein bars are those? Fudge graham? A lot of sugar alcohols in those bad boys. Or like some kind of artificial sweeteners leading to terrible diarrhea. What a sugar alcohol is, just so people understand. It tastes like sugar, similar to sugar in that it's sweet, but then your body can't absorb it. So if you don't absorb it, those large molecules hang out in your intestines and then through osmotic pressure suck in water. And then as a result, you have lots of diarrhea. Did he just order tuna and rice?
Oh yeah.
How is that the solution to his issue?
Ayo, tuna and rice, chick.
Can you at least get a fruit, bro? Just for God's sakes, eat a berry. The 1 penny man himself. What's up, buddy?
Dr. Mike, you're amazing, dude.
No, dude, you're amazing. And you're looking a little bit disheveled, I gotta say. What's going on, buddy?
I'm delivering burritos on the highway.
I hope you're being careful, because, you know,
am.
as a doctor, I have to preach safety here for you.
I found a bike lane. We're good.
How is the journey so far?
It's been the craziest thing I've ever done in my life. It's day 19 right now, but it's been so fun, so rewarding. Can't believe the generosity that I've seen. It's been so inspiring. My heart is so full right now.
Dude, you had a goal of 100,000 and now you've already crushed that goal. What's the new goal? You have to have a new goal in mind.
New goal is $1 million.
I think you're pretty close. I think you're like very close to that, aren't you?
We're getting there. We're getting there. It's very realistic, which is insane at this point.
I will say, watching your vlog, I was a little bit upset and nervous for you at the same time. What's going on with the veggies, man? You don't like veggies?
I don't like vegetables. I have to take like supplements for vitamins because I don't eat many vegetables.
The natural form is better, man. Like, well, okay, I won't harp too hard on the veggies thing, and you'll see why in a minute or so. But the next thing is, I gotta get you to wear sunblock because in that first video, you got burned. I hope you're wearing sunblock now.
I got some, Dr. Mike.
But you must be getting into ridiculous shape. You're biking every day for how many hours?
I have an Oura Ring that's tracking my daily calorie input, and I'm hitting like 4,500 calories burned a day, which is insane. 20 miles of walking, 25 miles of biking a day. It's gnarly.
I know that the perk of donating over $100,000 was that you will be willing to get a tattoo done by that person's choice of tattoo.
That's right.
And to make it interesting, I've come up with 4 options for you.
Ooh, okay.
Those options are not really for you. Those 4 options are for the fans to choose. And I'm gonna put up a poll of the 4 options, but I will give you an opportunity right now to sway the vote in any way that you want it to go.
Okay.
Are you ready to hear the 4 options?
I'm so ready, Dr. Mike.
Option number 1, this is the most heartfelt one. You will get tattooed on your body a QR code that anyone can scan and donate to the charity of your choice at any time.
That's amazing. I actually like that. That's not bad at all.
Number 2, this one is personal to me. And it's some piece of advice that is not only good for you especially, but also for the rest of the world. Eat your veggies. So you're gonna get a tattoo that says, eat your veggies.
That's amazing. Okay.
To help remind you and remind the world how important it is to eat vegetables.
Yeah, I think so. I need to see that on my body every morning.
This one is in memory of the penny challenge, with the goal of your penny challenge all in one. Option 3, what do you think about that?
Oh my gosh, please no. I really hope it's not that one.
We've redesigned the penny to say, in subs we trust, with good old Jimmy on the penny.
Oh gosh, that's so funny. Getting Mr. Beast on my body forever.
How would you feel about that? How'd you feel if you had to rock that?
Less excited about than the others.
And the next one is one that is kind of evil. You're not gonna like this one.
Oh no.
But if your fans are very angry, they might give you this one.
Okay.
We kind of gave you a basic tattoo idea. One that incorporates everything that you've seen in every basic tattoo ever. And this was actually hand-drawn by Call Me Chris of TikTok fame and YouTube fame.
Amazing.
Live, laugh, love to infinity with the dolphin and the butterfly wings.
That is so funny. Oh my gosh, that's hilarious. That might be one of the best ones.
Wait, no way, you like this one? I thought you would hate this.
I'm goofy with it. I think that's hilarious.
Which one do you want people to vote for?
I desperately want for everyone, because of my health in the future, eat your veggies. That'd be a great one for me. I would get the reminder daily, and I might actually start eating them.
You heard it here from Ryan himself, the 1 penny man, but we'll see what the audience decides.
Amazing, Dr. Mike. Let me know. I love you so much. Thank you for the generosity. This is so exciting.
Of course, man. Good luck. Most importantly, please stay safe out there. We want you in one piece, especially with all the good that you're doing. Thank you, man. Be well.
Awesome. Thanks, Dr. Mike. Take care.
Talk soon. Remember, you get to choose Ryan Trahan's tattoo that will live on his body for the rest of his life. The 4 options are right here. The link is down below to vote. It's basically my Twitter, so you can just head on to my Twitter and vote. Choose if you want to go with what he wants. You want to go with first before going to judge. Be-whoop.
My name is Nathaniel. I'm 27 years old. And I'm in a serious relationship with my car.
Interesting.
Morning, baby.
It's a pretty car, I'm not gonna lie. I'm digging the color.
It was love at first sight. His body and then his interior and everything just together just seemed to fit. And I just felt an instant connection.
You know, this objectophilia seems like it runs in a similar pattern as animism, where someone believes that an inanimate object has a spirit that is living on, and that's why they fall in love with it.
Nathaniel's relationship with Chase goes beyond dates and presents.
We have our times when we get sexual. Does that feel good?
There has been some research that has showed a sexual gratification or objectification of inanimate objects does sometimes run in a similar course also with autism. So I don't know if autism was in fact diagnosed in this case.
I'm 19 years old, and I'm addicted to eating sand.
Sand, okay.
I just love the crunch.
That's not good for the teeth. There's a condition known as pica, where individuals actually crave foods like sand, soil, paint, even metal objects, and there are treatments for it.
Bria is so dependent on that satisfying crunch, she turns to nail files when her sand supply runs low.
It has like sandpaper on it that gives me the same crunch. So I put it like in the back of my teeth and just go like this.
Essentially, you're sanding down your teeth. When you grind them down with that very abrasive surface of the sandpaper, you're actually doing serious damage to it. I wouldn't be surprised if she's gonna need dentures or like implants very early on in her life unless this gets addressed.
I'm 20 years old and I'm addicted to drinking gasoline.
Gasoline is toxic. And I'm not just saying drinking it inhaling it, getting it on your skin. In fact, individuals who work surrounding gasoline vapor have higher rates of certain illnesses. Animal studies have showed like kidney, liver disease from extended exposure to gasoline vapors.
I can't go a day without it. Like, I crave it, I need it. I'll wake up, go to the washroom, and drink the gas.
This is super dangerous because of a compound called hydrocarbons found within gasoline, which actually act as a central nervous system depressant. You can almost feel like you're drunk off of it, but the danger that it causes to your GI tract, your vital organs, outweigh any potential benefit of consuming it.
Stanley might be 31 years old, but for the past 18 years, he has gone to remarkable lengths to remain young at heart. Very young.
Okay, I understand if you're watching at home and you're quick to judge this gentleman and say, wow, this is clearly a disorder. Wait, the way we decide in medicine, in healthcare, whether or not something is a disorder is based on the patient's own life. If the patient is not having an issue maintaining a job, maintaining healthy social connections, maintaining a relationship. If all these major developmental aspects of life are normal, this is not a disorder. We have to be very careful with our definitions here.
And he doesn't just talk the baby talk. He dedicates 8 hours a day role-playing as a toddler.
That's an important fact to hear, because if you have to dedicate 8 hours of the day to do this, can you maintain a job? Can you maintain social connections?
It's a feeling of being safe, something I didn't have when I was growing up. And being an adult baby became my way of coping with the world and my own problems.
Humans are great at finding unique coping mechanisms. This works for him, something else may work for you. Just we have to make the decision together with a patient and a doctor whether or not that coping mechanism is A, appropriate for who you are, and B, whether or not it is distracting or detracting from your everyday life.
Stanley has even tried baby formula, but like every other toddler, he can be extremely selective.
I mean, baby food like that is basically just like mashed up fruits, so it's not like the end of the world eating that. But like baby formula, breast milk, all that really high fat content, you really have to be careful.
I don't have any broken bones, but I'm addicted to putting orthopedic casts on my body.
What?
I'm perfectly fine, perfectly healthy. I like the feeling of the cast around me.
Just wear a compression sleeve.
I've done like 2 full arm casts, 2 full leg casts. I've done 2 full leg casts and an arm cast. I've put on so many different casts, it's ridiculous.
He just wants to be cuddled, I get it. I need that too sometimes. I just don't go all the way to getting a cast done, but like sometimes I do that with the blanket and then I lay on top of it so I feel like I can't get out. It's like being swaddled.
I was 12 years old, I broke my arm rollerblading and I got my first cast. I got a lot of attention with a cast on. And it's just kind of been an ongoing process ever since then.
That is a medical diagnosis, actually. People who feign illness in order to get attention or sympathy, that needs to be obviously diagnosed and addressed if that's the case.
My name is Dave Gracer, and I'm obsessed with eating bugs.
Initial impression of mine is this might not be so bad because bugs are actually kind of nutritious.
He has eaten more than 5,000 bugs over the past 11 years.
Does he keep track of the numbers of bugs? That's interesting.
When it comes to getting bugs, you gotta kill them, and there's a variety of ways of doing that. I prefer freezing them because you go to sleep. So I think it's the most humane way.
You don't just go to sleep. You're viciously cold, and then you go to sleep. It's not like he's giving them a paralytic agent to knock them out and then freezing them.
David's interest in eating insects just kept getting bigger.
Grasshopper, grasshopper, grasshopper.
And bigger.
Fly pupa, cicada.
And bigger.
Scorpion tastes kind of like this weird plastic.
And you enjoy eating weird plastic? Like, I want to know his explanation. I have follow-up questions.
I started going into the woods and getting my own bugs, and I think the first ones I found was a whole log full of carpenter ants. And I tried those.
Ants are very rich in protein. Ants, grasshoppers, like grasshoppers almost have the same amount of protein per 100 grams as red meat does.
When he wants something more exotic, he goes to his personal supermarket, the pet store. Today he is picking up a specially ordered bug he has never encountered.
That is a monster. I will eat a monster.
You want to make sure that you're thinking about toxins that the bug has inside of them, the bacteria that's on the bugs. You also want to think about anti-nutrients that are actually meant to discourage predators from eating them by not allowing us to withdraw the protein from the foods. And it actually stops the protein absorption inside our bodies.
The Vietnamese centipede is the only species of centipede to have ever killed a human being.
Right in the oil. I'll season them again just real quick, a little bit of salt and pepper.
How does he know to season it with salt and pepper? How does he know those flavors go together if he's never eaten it before? That's just like throwing salt on an already potentially salty food and being like,
The heat not only cooks the insect, it also breaks down the poisonous venom.
There you go. Take a peek and see what we've done today for you, Dave.
Oh my God! It's still got very much the look of the beast.
The look of the beast.
But there's so much muscle tissue.
I feel like I was about to throw up.
I understand why you say that. This concept isn't that out there for me because by eating more insects, we can place less strain on our land, have highly, highly nutritious and protein-rich foods brought to our diet, especially in areas where we don't have farming abilities. I've actually tasted grasshopper before. Not too shabby.
We're the strongest
Family in the world.
Nick, Callie, Dylan, and Jessica Best
You could do it.
train their bodies up to 240 hours each week.
That's a lot of hours of training.
While some pediatricians warn against weight training for kids, 11-year-old Dylan routinely deadlifts 130 pounds.
I do like working out. It's like my coffee in the morning. If I don't do it, I don't feel right.
I love that this kid is so mature. Initially looking at this, 11 years old, is probably on the earlier side of starting to lift heavy weights. The idea is that you risk injury when you have non-fully formed muscles, tendons, ligaments, bones, and start lifting heavy weights. It can be done safely, you just need to be very careful and monitored by a professional. Kids like below the age of 7 shouldn't be doing weightlifting at all. Starting at age 7, you could start incorporating strength training, that's good, but just not with heavy weights.
Oh my gosh, JJ.
Experts recommend children her age train with 1-pound weights. But she can lift 100 pounds.
That's probably not ideal. That being said, I doubt that this is gonna do any real damage to her growth plates. That was kind of a myth that we had published by the American Academy of Pediatrics in 1983, where we thought that could happen. It was a potential risk. And then as time went on, we saw that happen less and less, especially with proper training.
Dylan and Jessica consume nearly twice the recommended calories for their age.
While we do give recommendations on caloric intake, that is a wide-ranging recommendation, needs to be individualized. So for children that are highly active like them, and we see how their weight and their BMI is trending, we can make different changes to their diets and to their recommendations. So the fact that they're eating a lot more than an average child isn't that wild to me because they're burning a lot of calories by doing all these workouts several times a day.
Hi, I'm Kelly Athena, and I'm obsessed with rescuing food from dumpsters.
I'm with it. We waste so much food in this country while other countries starve. I don't think this is a terrible idea. I just hope they're doing it safely.
The average American household spends over $500 a month on groceries.
And we oftentimes spend money on groceries that look the prettiest and waste the food that may not look pretty, but is just as nutritious, just as tasty.
Everything I have in my fridge, I got from the dumpster. Apples, cucumbers, pickles, condiments, grapes, cantaloupe. Here's some soy milk I had, and it even expired more than a month ago.
Sometimes it's a full-on expiration date, but you really need to understand what that date is for, because that date could be like for ideal freshness or for ideal taste. It still might be calorically, nutritionally valuable.
I'm not afraid to eat right out of the dumpster if it's good stuff. There's this peach. If I peel it, that'll be pretty safe to eat. If I eat out at a restaurant, I don't know who's preparing that food back there.
I don't know if I'm a fan of that logic. You don't know who's preparing the food, at least it's cooked. Here, you're getting food that's been living in a dumpster. What if a raccoon pooped on it?
B is spicing up the 4-month-old dumpster pizza with cheese 2 weeks past its expiration date. Overripe tomatoes Kelly found a week ago.
Maybe a little diced fennel.
Fennel found at the bottom of a trash bin just this morning.
No, it's a fresh dumpster fennel.
And frozen chicken.
Chicken, if it was even not frozen for a short period of time, bacteria can start proliferating on it, especially if it wasn't stored or prepared properly. Oh man, I've had a personal close friend of mine who eats thoroughly cooked foods, eat out at a restaurant, get an infection from one of those foods by both parties. Don't road rage, that's not healthy. Ever grab a moving vehicle? That is an argument/fight you will never win. And whatever sound effect I just heard from her grabbing the car door there didn't sound good. Also didn't sound super realistic. I'm assuming she's gonna have like a dislocated shoulder here or something, but it didn't sound real. It sounded too meaty. He was like,
He must have driven off at some speed to dislocate his shoulder.
Dislocated shoulder. The most common type of dislocation is an anterior shoulder dislocation.
Hey, Lily, how are you feeling?
Yeah, I'm all good. I'm ready to rock and roll.
In general, I don't like keeping patients in slings like this because it actually causes an increased rate of frozen shoulder where you have decreased mobility, you get less range of motion, thereby having less.
Yeah, it's your home. I get it.
It's my dad. He's in the back. He's got early onset dementia, but you wouldn't know if you met him. He just forgets a bit sometimes.
Even mild dementia can become problematic when it comes to tasks like managing your money, paying bills, being susceptible to scams. Think about it, if you don't have a good memory, somebody can call and say you didn't pay a certain bill, asking you for personal information, and you can just give it up to them. And speaking of scams, if you see someone that looks like me or using a name similar to me giving out WhatsApp phone numbers, that's not me. Just like the fake accounts on Instagram, that's a fake account on YouTube. Report that.
He's not here.
Did she just leave her dad in the van? Like, I don't understand. Was he awake? Was he alert?
Come on, Cadigan. Walters.
And she said mild dementia. Like, mild dementia shouldn't interfere with navigation.
I think I might need...
You can do a makeshift tourniquet, but those are never as good as commercial grade tourniquets. Those can actually cut off the circulation, and you also need to make the decision of how bad the person's bleeding out. You can stop the bleeding with just some pressure. That's a better option. Having a tourniquet on, especially a serious one for a long period of time, can cause harm to the limb.
Anything in there I can use as a dressing? What, like a nappy, maybe?
How about calling for help? Like, they're making a tourniquet, but at the same time, they're like, so what's up? Well, you got diapers? Vitals look semi-realistic. We have a 91 pulse, a 96 pulse ox. I do not see a blood pressure on that machine. Maybe they didn't check it recently.
Ethan's got the Huntington's gene.
So Huntington's disease is a progressive neurologic disorder where essentially the brain and the neurologic system starts breaking down over time. And it's a deadly, deadly illness. I mean, like, from the time the disease presents itself, you have like 10 to 30 years before death. It's that quick. And there are genetic tests available for that. And it's even sometimes a hotly debated topic of whether you should be tested for this. If you're not doing it for genetic planning for future children, finding that out could seriously impact your life for the good or for the bad. So it really depends on what kind of personality you have, whether or not you want to know. This should happen. This is a serious trauma. She's bleeding out. We should have blood drawn already. We should have tests going. She should actually be fully undressed because you need to do a visual exam to see where she's bleeding, where the bruising's happening, if you've missed a laceration somewhere, because that delay in diagnosis could cost her her life.
Okay, you ready to intubate?
There should be a full team here. Like, everyone's too calm and cool. This doesn't seem realistic at all. What is he even doing?
Okay.
Emma, who did this? What happened?
Can I get you to wait outside, please?
This is why he needs more staff, so he's not doing this alone. This is so weird for me to watch. There's literally usually 7 more people in the room. Drawing labs, controlling the patient's family, doing chest compressions if need be, putting in IVs, gathering the patient's belongings, entering data into the system, putting more orders. Like, there's so many things that need to happen all at the same time.
You can't be in here right now.
She's my sister!
Also, you need to make sure that you've intubated correctly and it's not in the patient's stomach.
It's not in the patient's stomach.
I'm a doctor. Just tell me what happened.
Okay, I'll explain everything outside.
Oh my God, did he intubate into her stomach? No!
She's been seriously injured.
Consult, which, like, okay, fine, you can call that, place the order, whatever, call who you need to call. But like, the fact that he's like not taking care of the patient right now is a big problem.
Oh, she's been like this. Then you check the placement, the tubes in her esophagus.
Oh no! That's why you need more people in the room! Who is the one bagging the patient? Remember, he didn't hook her up to a ventilator. He hooked her up to a bag, so someone had to be sitting there, squeezing it and watching her pulse go up and her oxygen saturation go down.
You're here for Emma Nash, is that right? You're her sister.
I am.
If this is about Emma, I'm a fiancé.
When you're intubating a patient, the risk is that you intubate their esophagus by accident. But that's why you check. You could check the O2 sensor, or you could put the little stethoscope on the lovely chest and see if the chest is rising, not the stomach. Another thing you can do is obviously get a portable chest x-ray for placement, but that is obviously not ideal because it takes longer.
Gonna introduce me?
Sister, whatever. Anniversary of this channel is coming up. If you have a great idea of something that I should give away, jump into the comments section right now. My 3-year-old is not vaccinated, and there is currently a measles outbreak in my state. Any suggestions for precautions I can take to protect her would be very much appreciated. Frank's hot sauce.
I put that on everything.
Me trying to make it through a semester.
Honestly, when you're just going, you just gotta go.
He kind of thick. What do you think about that? He kind of thick. What do you think about that?
So if it's an STD, how did I get it? The person may not understand that it's a sexually transmitted disease and they got it because they had sex with somebody. Or they say that, well, I never had sex with anyone outside of my wife, so how did I get it? And then it's like, maybe your wife cheated. Doctors before an x-ray be like, don't worry, this is perfectly safe. And then the dude goes to Egypt to press a button. Imagine how many x-rays they're doing all day. If they're gonna expose themselves to that sort of radiation all day, that's really unhealthy. But getting a single x-ray, especially if you need to identify the source of an illness, that's worth that's an acceptable level of risk. I was today years old when I realized that caps on medicine bottles are actually serving sizes. I use this method with Adderall and I'm currently cutting my grass with scissors. I've never heard this. I mean, I know that about like Pepto-Bismol and the liquid medications, the cap has a serving size on it, but it's usually written on the cap. Otherwise, I don't think that makes sense for pills and tablets. And if you did that with Adderall. Nursing supervisor, me after forgetting to wash my hands. Yes, we have nursing supervisors that are very vigilant. They're like, hey, wash your hands. The reason being is back in the day when people didn't wash their hands, contamination rates, infection rates, hospital-acquired infection rates were through the roof. Remember to always use skincare products as directed. What's about to happen right now? Is he using a toilet brush? I don't get it. Oh my God, what is the last one gonna be? This is not medical. It has no explanation. When you find out the kid bullying you is unvaccinated, so you sneeze in his lunchbox. Modern problems require modern solutions. By the way, I just watched some show called You. It's super creepy, and the killer on the show actually killed his victim using peanuts because he knew he was allergic. So clearly this theme is going around nowadays. Boyfriend, you are my drug. Girlfriend, you can't live without me? No, you cost too much and you ruined my life. Lol. Me trying to hold my farts in the OR. It's not medical humor. Yeah, you probably shouldn't fart in the OR because there's a lot of people in there and you're trying to do a surgery and save someone's life. Keep it in. Soldier has a tiny scratch on his leg. Civil War doctors. Yeah, honestly, I don't know what was up with surgeons and doctors back in the day. It was just like, patient has an infection, bleed them out. Patient has this, put leeches on them. Patient has a cough, give him some heroin, it will control his cough. The gender neutral term for sugar daddy is glucose guardian. Glucose guardian. I still think gender neutral term, you could still say sugar daddy. Because I guess, I don't know. An actual depiction of me at 11 p.m. trying to focus on the same page for 2 hours because I spent the whole day looking at memes. Okay, you're not allowed to use this channel as a reason why you're not studying and procrastinating. You could use this channel as a study break, but please don't let it distract you for 2 hours. Eye has eyelashes to prevent stuff getting an eye. Eyelash gets an eye. Eye, you have become the very thing you swore to destroy. Is this Star Wars? You guys are probably gonna bash me like crazy because I have no idea where he's from.
Afraid, are you?
Back in my day, we worked a lot harder than you kids today. Your soda used to have cocaine in it. You haven't. If you study really hard in neuroscience, you too can become a United States Secretary of Housing and Urban Development. This is really funny. Ben Carson, oh my God. So random. That's like, if you study really hard in medical school, you too can have a YouTube channel. That's very successful. When you look in the toilet of your patient with C. diff. What? Thomas has never seen such. C. diff stands for Clostridium difficile. It's basically an overgrowth of bacteria that happens in your colon. Usually as a result, at least nowadays, of using antibiotics and wiping out the rest of the bacteria, and then C. diff overgrows and causes all these symptoms. Massive, can I say it again? Massive diarrhea with a horrible smell. I said you're the good kind of fat. Oh, this is so cute. It's two avocados just chasing each other. You want carbs? You can't handle the carbs. Honestly, after keto, I can't handle the carbs either. I had my first bit of sugar this weekend, or I had mochi ice cream and a cookies and cream milkshake. And I feel like I almost had a seizure afterwards because it was so good. But then I also had a stomach ache, but it just tasted so good. When you were the first to leave the exam, yes.
Honestly, every time I left an exam, there would be a conference outside. What did you get for 36? What did you get for 38? And without a doubt, every time, the attendings or whatever, the professors would come out and shoo everybody away from the room saying, you're making too much noise discussing the exam. Medical students on clinical rotations. Yo, this is so true. Walk into a hospital. Whose ever white coat is the cleanest, if you look at the residents and the med students, whoever is the freshest, that person is the least experienced. Me trying to study neuro. I had more trouble with pharmacology. Learning all the inside chemistry behind every drug, mechanism of action, half-lives. Oh, hey you. Do not confuse your Google search with my medical degree. Google search is not equivalent to